Good morning, everyone. This is Janet Hill with the Rock Island County Health Department. Thank you for joining us. Today we have Amy Thoreson and Nita Ludwig of the Health Department to talk about masking guidance and rapidly rising case counts. Rock Island County does not have cases to report yet today. We will report those later this afternoon. Our cutoff time is later in the morning, so we want to be able to give you accurate case count, so watch for that later on this afternoon. So let's start off with Amy with regular talking points. Thank you.
Yesterday, the CDC released information that the Delta variant is now found to be the dominant variant spreading in the United States, being identified in 8 out of every 10 samples that are being studied. Public health researchers are finding that the Delta variant is uniquely different than earlier strains of this COVID-19 virus and is much more contagious and causing more severe illness than those affected. Additionally, some vaccinated people can get Delta variant in breakthrough infections, and these individuals could be contagious. The virus and its spread are especially concerning for 2 groups. Those who cannot be vaccinated, both children younger than age 12 and those individuals with medical conditions that do not allow them to be vaccinated, and individuals who are not able to get full protection even though they are fully vaccinated. And this includes those who are immune compromised or have other medical conditions. As a result, the CDC has made the following updates to its mask guidance. In areas with substantial and high transmission, CDC recommends that everyone, including fully vaccinated individuals, wear a mask in public indoor settings to prevent the spread of the Delta variant of COVID-19 and to protect others. CDC recommends that community leaders encourage vaccination and masking to prevent further outbreaks in areas of substantial and high transmission. And the CDC also recommends universal indoor masking for all teachers, staff, students, and visitors to K through 12 schools, regardless of vaccination status. They're encouraging children to return to full-time in-person learning this fall with various layers of protection in place. So what does this update and guidance mean for our area? The CDC has 4 levels of community transmission. From low to high, they include low, moderate, substantial, and high. Both Scott and Rock Island counties are currently at the moderate transmission level, but case counts are rising quickly. The week-over-week increase in Scott County was 55%, and it was 125% in Rock Island County. Right now, this means that the mask guidance for our community as a whole has not changed, but it could quickly if we don't stem the rapid increases in infections on both sides of the river. For the month of June, we saw a total of 88 positive cases reported for Scott County. For the month of July through yesterday, 211 positive cases have been reported. And of those 211, 180 or more have been since July 13th. While these numbers aren't what we have seen in the past, they are concerning for the public health community and for our healthcare community. I'll now turn it over to Nita.
In Rock Island County, 47 positive cases were reported in June. So far in July through yesterday, 127 cases have been added, with 94 of those coming since June 15th. We will report today's cases this afternoon. Most troubling is the rapid increase in hospitalizations. Today, 9 people are hospitalized in Rock Island County with COVID-19. More than 75% of residents 65 and older have been fully vaccinated, so the people getting seriously ill now are younger and have been eligible for vaccination since March. We have seen a version of the story numerous times over in the last 16 months. Rising cases now has meant rising deaths a few weeks later because COVID-19 patients suffered greatly sometimes for weeks before they pass away from COVID-19. Almost every person getting sick now could have been vaccinated to prevent serious illness. And the school year is now upon us. Rock Island, Milan, and United Township and East Moline schools start next week. Other districts on both sides of the river start later this month. But make no mistake, with more indoor activities, the virus will spread quickly. Remember that no one younger than 12 is eligible for vaccination under the federal government's emergency use authorization. Those of us who are eligible to be vaccinated must protect the ones who cannot yet get the shot. The start of school is also concerning because we are seeing this kind of spread at our current vaccination levels of 52% in the 12 plus population, and our vaccination levels have pretty much stalled. Low vaccination levels allow the coronavirus to continue circulating, continue mutating, and continue to potentially create stronger variants. The biggest concern is that a variant will emerge that evades our vaccine protection. Because higher vaccination levels reduce the spread of the virus, there's less chance for the virus to spread and mutate. We have to vaccinate our way out of this. As a result, we recommend that you follow the following actions for our community. Of course, get vaccinated if you're eligible and able to. Visit vaccines.gov to find a shot near you. Get tested if you believe you may have symptoms of COVID-19. Testing is available at many of the Quad City pharmacies and healthcare providers. If you are at high-risk individual or around a high-risk individual, you should consider the protection that wearing a mask can provide you. Be safe when you're out and about. You likely don't know the vaccination status of individuals you're around in the community, and your activities out and about likely will have different risk levels. Throughout this pandemic, we in the Quad Cities have been keenly aware of the differences between Illinois and Iowa. Yesterday, Illinois Governor J.B. Pritzker said Illinois will follow the CDC guidelines and masking will return to counties with substantial and high transmission. Most of the bottom 2/3 of Illinois have substantial or high transmission rates already, with pockets including Henry, Bureau, and Stark counties near us in the upper third of the state. We will continue to keep you informed of COVID-19 spread and recommendations as we see changes. We want you and your family to be informed and able to make the best decisions possible to protect yourself. The county level data is also available on the CDC website, and we will be posting a link in our social media on that. Thank you.
Thank you very much, Amy and Nita. We do have a couple of questions that have popped up, so I'll let both of you address this. Maybe we can start with you, Nita, since you're still on screen. Do you have an idea or account of how many of the hospitalized patients are unvaccinated versus vaccinated?
We really don't get any further information from the hospitals other than that they have the number of patients hospitalized in the county. So at this time, I do not know their vaccination status. What we have seen with other positive cases that are reported to us through laboratory results are the majority of those are unvaccinated individuals.
Amy, do you know information for Scott County?
No, we really aren't getting that information either. I've heard anecdotally from Genesis that more than 98% of the people that are hospitalized are unvaccinated. So I know they're tracking that information. It may be best to reach out to them directly.
And are our counties seeing people who have been vaccinated test positive for COVID-19? Do you gather that, Nita, from the contact tracing process?
Sure. So when we do contact tracing with the positive cases, we do try to determine if they've been vaccinated or not. But again, I can tell you the majority of those cases we have seen so far are unvaccinated.
Amy, do you have anything to add for Scott County? I know we're not doing the contact tracing here in-house.
No, I don't.
Okay. And the increase in cases that we are seeing and discussing today, could this be related to the July 4th holiday? We know this is something that Dr. Katz, our medical director, has been watching closely.
Well, we know we've seen cases after all of the holidays. We've always seen a bump in cases. So we could assume that it's that, but again, we're not doing the contact tracing ourselves, but know that as people travel, as they gather in areas that may be at a higher spread, or see people that may have been living in an area, the potential of for the virus to spread is really out there. So we know that there's a lot of reasons, but holiday gatherings are typically something that we have seen as a result of increases.
And then Nita, with Rock Island County Schools starting on Monday, in person and full time, what are your main concerns? Are the schools going to be hot zones, especially among the younger kids who are unable to be vaccinated?
Sure, so that is kind of the concern that we have, is there's a lot of students that are 12 and under that haven't had the opportunity to be vaccinated yet. And then there are certainly people that are in the age group to be vaccinated but haven't gotten it yet, or haven't gotten fully vaccinated yet. So our position in public health is that they should remain masked when they're indoors.
What can parents do to protect their unvaccinated kids once they're back in that closer school environment?
So they can certainly ask their own children to be masked whenever possible in school, in classrooms. That's certainly an option for every parent. And, it's up to each individual school board and district in Illinois to decide their school policies.
And then Amy, maybe we can have you answer this last one. What are your recommendations for those with compromised immune systems?
Well, again, we always encourage individuals in those situations to talk to their provider. Likely, if they have a immune compromised system, they're in a provider's care. And so to have conversations with him or her about whether they should be vaccinated. If they already have been vaccinated, I would encourage them to start masking if they aren't already, just as that extra layer of protection that the face covering provides. We really don't want people who are already dealing with medical issues to have more medical issues if they were to be exposed to the COVID-19 Delta variant.
And then any talks of hosting vaccination clinics at the schools once they are back in session? Nita?
Sure, so we do have a school-based health clinic. It's called the School Health Link, and they actually have been doing COVID-19 vaccinations since before school let out this last spring, and they have continued to do some of those districts even over the summer, and I know they have some scheduled already for August as well. They have done a great job. We've gotten a lot of kids vaccinated through the schools. We certainly can vaccinate them here at the health department. We're doing Pfizer Fridays here. So anyone over 12 can get vaccinated here at the health department on a walk-in basis here on Fridays. So we can absolutely do that. But yes, our school health clinic will also be working with the schools, and they will be giving parents that information when those are scheduled.
And Amy, I know we'll be meeting with our school districts very shortly. Do you have any updates on vaccine clinics, or will the primary method of vaccination for these age groups be with their providers' offices or at local pharmacies?
So we have had some conversations with the schools, and we'll revisit those in the next couple of weeks, as you mentioned. Certainly, we know that providers, particularly pediatricians' offices, are vaccinating. And so as children go for their back to school physicals and shots, they may be able to get their COVID vaccine at that time. And we're working with some other partners to see how we may make additional opportunities available. But vaccine still is at pharmacies. It's still at places like Target and Walmart and Walgreens and other locations. So it's readily available as people begin to start thinking about what they need to do to protect themselves going forward.
And can you also share for both of you the ages of those who are testing positive, if you have that information, or those in the hospital? I know there's trends we've been reporting on throughout the last year and a half.
Sure, for Rock Island County, we are now reporting on Monday, Wednesdays, and Fridays as these cases have been rising. And if you look back to those last couple of press releases, we do see kids under the age of 12 who cannot be vaccinated yet. They are testing positive. And then we have more people like in their 20s and 30s that are testing positive than we do in the 65 and older. And we do think that's a result of we have a significant amount of those over 65 that have been fully vaccinated. And now we need to really make sure that anybody under the age of 40 gets vaccinated when they are eligible and able to.
And Amy, do we have a grasp on the trends we're seeing right now for ages?
Yeah, so our average age this month has been 36, 37 years old, so it is a younger population. We have traditionally been seeing the percent of individuals younger far exceeding the percent of those who are in that 65 plus. So as I just looking at the numbers real closely, we're at about 10% of our cases this month in the 65 plus. And when you look at 18 and under, we're at 20%. The 19 to 24 population is at 13%. So we are definitely seeing a switch to more younger cases.
And then there's a question here about in Iowa specifically, where masks are optional in schools, what safety tips should parents be taking with that in mind? I'm assuming closely related to what Nita was saying earlier about the schools in Rock Island County.
So in Scott County, we have been talking with the superintendents and the non-public schools and sharing information all along. It's our understanding in our last communications with them that they will be honoring that mask's optional wording, but we'll have some more conversation. I think as parents, I have to in the schools, I'm going to have the conversation with my kids to say, you may need to be wearing a mask at school. They are both vaccinated and our family is vaccinated, but I don't want to take a chance that they may expose someone if they were to come down with the variant, or if they were to share that variant with somebody else. So I think as parents, we need to be having conversations with our kids about either getting vaccinated or perhaps choosing to wear the mask, because I know those are extremely difficult decisions. Everybody wants a school year that looks much different than it did last year, but we really don't want to have a school year that could look worse than last year.
These last two questions might have to go to Nita. We don't have the direct hospitalization information. That's something that the hospitals would need to share. Did you have an idea of how old the patients in the hospitals are in Rock Island County?
No, we do not get that information. We simply get the number of inpatients with COVID-19 every day.
Okay, so I'm sure both Unity Point or Genesis would be happy to share that if you can reach out there. And then since you are still doing the contact tracing, it's my understanding, do you have ideas of where COVID is being transmitted right now? Are you hearing that it's at home, at work, or other places?
Sure. Well, the mask mandates or guidance, they have been relaxed for some time now before the Delta variant really came to be more predominant. And so it's really, people have caught infection from all of these different sources. It could have been a birthday party, or it could have been, in a gathering at work or other places. So right now it is really all sorts of places that people can get the infection, which is why it is so dangerous, because it is highly transmissible.
Thank you so much to Nita and Amy again for sharing this. Thank you to our media partners for joining us today. We will follow up with our press release that has some of the detailed information that was shared. We will also post today's recording on our websites and on our social media pages. We will provide the links, I know, to the CDC's website where you can see the county level data and the transmission levels. So as things continue, you'll be able to catch those as well. Thank you all for joining us. We will continue to share information as it's made available, so please stay tuned for anything more that we'll have to share. Thank you.
Thank you.